let's talk about sleep. This is so overlooked when people are trying to lose weight. So in South Africa, we know that about 4.62 million people have sleep disorders or have disordered sleeping. So guys, you need to listen carefully now, because you could be one of the people that has disordered sleeping, and one of the many side effects of your disordered sleeping is weight gain. So when it comes to the amount of sleep, we know that less than 5 hours is a problem, and more than 9 hours could be a problem. It depends on how old you are, what person it is. But the average adult, 9 hours is enough sleep. Okay, so the research shows us that less than 5 hours, or you see that term again that I taught you, all-cause mortality increased by 15%. So you don't want to do that. You don't want to allow your binge watching or your work to make you sleep less than 5 hours. So now, usually when I have a live audience, I like to get people to tell me when in history that the average adult sleep 9 hours per night. So you can, on your piece of paper, just quickly write an answer, and then you can let me know in the chat box a little bit later if you were right. But believe it or not, the average person slept 9 hours a night in 1960. What happened in 1960, friends? What was invented in 1960? Television. Television was invented. And that's when things just went south. We suddenly had something that was shining blue light into our eyes, suppressing melatonin production. Actually, not so badly, but it did. It's actually the melatonin. We'll talk about melatonin just now. So look at this. So you can take a screen cap of this, because people actually don't know this. If you have teenagers in your house, now teenagers tend to want to not sleep anymore. They want to be up at night. For some reason, they switch on late at night, but your average teenager needs to sleep 8 to 10 hours a night. And the general recommendation for adults, it's a general recommendation, is 7 hours, but in bed for 7 hours and 20 minutes to be able to sleep for that time. But there's a big but here. You need to figure out how much sleep you need. You need to figure it out. And how you figure that out is only by going to bed at the same time every night and trying to figure out, when do I wake up naturally? Okay, so choose a time, 9 o'clock, and you're going to have to do that over a period of time to start getting an idea of what your natural need is. And your need will change as you become metabolically healthier. Okay, so sleep disorders can be problems with initiation, can be problems with waking up, but at the end of the day, if you have a sleep disorder, within days to weeks, you will start seeing side effects. And the first side effects that disordered sleeping gives people is anxiety and memory impairment and problems with decision making, problems with reaction time, cravings and addictions, and dysregulated immunity. Are you seeing this? This is days to weeks. This is not months to years. And what happens when people are anxious? What do they do with food? I mean, we stress eat. You eat. Right. But there's another problem now. So when it goes on for longer, now it's weeks to months. Now you start developing, look at that, impaired glucose tolerance. You develop, of course, obesity, because that's what follows impaired glucose tolerance. And you can become a diabetic, and eventually you become depressed. And because you're depressed, you eat more, and you pick up more weight, and your diabetes become worse. And where did this whole thing start? It started with disordered sleeping that went on for long enough. Then months to years, hypertension, heart attacks, and strokes. All of that connected to disordered sleeping. And I mean, you can go and look at the chemistry of this, from growth hormone that drops. Remember I said growth hormone is important? Testosterone, all your hormones can be affected. Let me just say this about testosterone. What a beautiful hormone. And ladies, yes, you have testosterone. And some of you may need to go and test your testosterone levels together with your female hormones. Guys, if you're over 40, just have your testosterone tested. It's just a good thing to do because maybe you were sedentary for too long. Maybe you carry too many fat cells where there was peripheral conversion in your fat cells of testosterone, and you may have to test that. But look at that. Leptin is decreased and ghrelin is increased. Hunger, dopamine is decreased. Serotonin is decreased. Thyroid, cortisol. You don't want to produce more cortisol because cortisol, when there's enough of it in your system or too much of it, will suppress growth hormone, testosterone, insulin, serotonin, and will have an effect on your immune system. So you don't want to do this. This is so important. So where do we see more sleep disruption? Well, it's tough to be a lady because I mean that those hormones from menstrual cycles to pregnancy to menopause. But there are solutions to that. Advanced age, as you get older, you have to start looking at your sleep a little bit better. Okay, when you already have anxiety, depression, it could have an effect. People with health conditions, cardiac, things like that, and some medications can give it to you as well. Now, more common things are stimulants. You drink that strong cup of coffee and you're used to falling asleep, but maybe your sleep is not the quality that it should be. Okay, stress. And then there are people that have now become overweight. They've got sleep apnea. So take note, if you snore loudly and people can hear you in the other room, or you stop breathing between your snoring, and you have a nice thick neck already, and you're overweight, and you're hypertensive, and if you're a man, which increases your risk, you need to probably do a sleep assessment. Now, they do these things at home these days. You don't have to go to a laboratory to go and do it there. And then there's other things like shift work, asthma, restless legs, seizure disorder medication, and other airway disruptions. Okay, but guess what? Here are the big causes. These are the big boys in modern society. Is our addiction to watching all this. It's like the never-ending loop of new programs being spat out. And this probably is one of the biggest reasons why people don't get enough sleep. So how do you fix it? Do the routine thing that I explained to you just now. Have a proper wind down in the evening. Get your circadian rhythm reset. And I'm going to explain to you how you do that just now. And be careful of 12 to 5 in the morning when you work. It's called the circadian trough. Even if you sleep in the day. I feel sorry for people that have to do shift work. It's just not a good time to do work because of the circadian trough, that where people's attention just is not as good as it should be. And then how do you reset your circadian rhythm? Well, some of you may not know this. Early in the morning, you need to stand in the sun. Full sunlight, please, no sunscreen. You don't have to look into the sun. You can look in the direction of the sun, and retinal ganglion cells in the back of your retina. They're called intrinsically photosensitive retinal ganglion cells. They contain something called melanopsin, and they will reset your circadian rhythm by speaking to your hypothalamus in your brain while standing in the sun. Okay, obviously many other benefits of the sun, which I'm going to mention just now. But this is how you start sleeping. Then another unbelievably powerful habit that I really want you to look into is if you take 3 power naps a week. They don't even have to be 30 minutes. They can be less than 30 minutes. You don't even have to fall asleep. This can literally be in your car. It can be on the carpet in your office. It can be anywhere. But if you're a female, you'll reduce your risk for heart disease by 35%. If you're a man, you're going to reduce your risk for heart disease by 67% by taking 3 power naps a week. No pill has ever been invented that works as well as this. And you are going to feel good. It's going to be good for your overall wellness. Can you catch up sleep? It's a question people ask me. And I guess we all grow up thinking, yeah, you can catch up sleep. The answer is no, you can't. You can't go and find a cabin in the woods and go and sleep there for a month. you can only in the short term, so maybe 2 or 3 days, then you can recover from, the irritability and the fatigue, things like that. But you can't actually catch up sleep. You need to just get your sleep sorted out and do it right from day one. It's also very important that you have the right environment when you're sleeping. So it needs to be like the screen now. It needs to be dark. Have blackout curtains. But please avoid in the dark doing this. Now, I'm guilty. All of us are guilty. But these blue white lights will suppress the melatonin in your brain, and you will have lower quality sleep. As a matter of fact, because we don't use candlelight in our homes anymore, this has become a really big problem. Candlelight's it's an orange dark light. Now, obviously, when you burn candles, please get organic beeswax candles. You don't burn petroleum candles inside your house. But the blue white light and the intensity of blue white light that some homes have are not conducive for good sleep. You're not going to sleep well. So low intensity yellow light is how you want to light up your living rooms, your dining rooms, your bedrooms particularly. Must be low intensity. And if you want to read at night, use a yellow light to do the reading. Don't read on your iPad or read on your iPhone, because the computers and the iPhones and the Android phones suppress more of the melatonin than what a television would do. And also, if you're going to be watching television, have lights on in the room so that the television isn't the only light source. So the last thing, and I'm going to end off here and we'll continue tomorrow night, is I'm going to challenge you to figure out how much you need. This is very important. Just to go through this process, like I explained to you, so that you know what your sleep need is.